Very good morning, cadets. Hope you are doing well. We are in chapter number 2, the role of government in health. In my previous video session, we discussed about the meaning of what is health. Health is absence of illness and injuries. WHO defines health is absence of physical illness and injuries as well as mental illness. So if someone is fit and fine both physically and mentally, he is declared as healthy citizen. Okay, we studied about the comparative conditions of Indian healthcare system. And what do you mean by public health, which I explained? The public health is a healthcare system in which the hospitals or the public health system which are run by the government is called as public healthcare system. And later we also studied about the story of Hakim Sheikh and a storyboard of cost of a cure. Cost of a cure. The two friends, Aman and Ranjan, discuss about their viral fever and both got treatment in a different place. This all I explained you in detail. Okay. Today let us move to the topic, that is public and private healthcare system. From the above story, you must have understood that we can go roughly divide various healthcare facilities into two, that is public health service and private health facilities. So two healthcare services available in India, one is public health and second one is private health facilities. Now let us study what is public health service. Public health service is a chain of health centers and hospitals run by the government. So, try to please. So, what is public health? Public health service is a chain of hospitals. So, public health. Sorry. So what is public health? Public health service is a chain of health centers and hospitals run by the government. Please write down this point. The public health service is a chain of health centers and hospitals run by the government. They are linked together so that they cover both rural and urban areas and can also provide treatment all kinds of problems, from the common illness to special service. So, what is public health care in a village? At a village level, there are health centers where there is usually nurses and a village health worker. They train in dealing of common illness and work under the supervision of a doctor at PHC. So please write down this. What is PHC? PHC is nothing but primary health center. What is primary health center? Primary health center is a part of public health service maintained by the government in a village level. So who are the part of PHC? You can see in PHC the trained nurse will be there, that is, and as well as health worker. So you can see these people in a PHC, that is public health center, primary health center. So try to understand primary health center. The meaning itself says it treats in the initial stage or a primary treatment like a improvised first aid center, because advanced treatment cannot be done in PHC or the primary health centers. At a district level, we have district hospital. So what is there in a district hospital? Right in front of our second gate, we have district hospital. So in a district level, district hospital supervises the working of primary health centers. Large cities have many government hospitals, such as one where Aman was taken, and also specialized government hospitals such as one in Hakim Sheikh story. So try to understand, in a public healthcare system, in a rural places we have primary health centers, and primary health centers we can find nurse as well as doctors, trained doctors in a primary healthcare center. Okay. The health service is called public for many reasons. In order to fulfill the commitment of providing healthcare to all the citizens, the government has established these hospitals and healthcare centers. Also, resources needed to run the service, these services are obtained money that we public pay the government taxes. Hence, such facilities meant for everyone. One of the most important aspects of public health system is that it is meant to provide quality healthcare service either free or at a low cost. So please try to understand what is the purpose of PHC. To provide quality health service either free or at a low cost. Please write down this. The main intention of primary health care center is to, or public health care center is to provide quality health care services either free or at very nominal cost. In the case of Aman, what the money spent by Aman? Aman spent just 150 rupees. So even the poor can seek treatment. Another important function of public health to take care action against to prevent the spread of communicable disease. Please write down this the name, that is tuberculosis, malaria, jaundice and cholera. So public health system, try to understand, public health system is called because it is purely maintained by the government. From where the public health system gets money? That is the taxes which we pay. The taxes which we are paying, the money which is collected from the tax is diverted or channelized to the public healthcare system. Please try to understand. So public healthcare system try to provide quality treatment in a low cost or in a very nominal cost. That is a very important purpose of public healthcare system. This is organized by the government which with the participation of people, otherwise it is not effective. For example, when taking a campaign, we see that mosquitoes do not breed in water, coolers, rooftops, etc. has been done in the houses of areas. During the rainy season, you can see a lot of advertisements related to how to protect yourself from mosquitoes. All these they are called as campaigns, where campaign is nothing but efforts to generate or create awareness among the people. According to our constitution, it is a primary duty of the government to ensure welfare of the people and provide health care facilities to all. So the constitution which we discussed in the chapter 1, constitution clearly says it is a duty of the government. What is the duty of the government? To ensure welfare of the people as well as provide health care facilities to all the citizens of the country. The government must safeguard right to life to every person. Please understand, Article 21 of Indian Constitution guarantees right to life. Article 21 of the Indian Constitution guarantees right to life. The court said that the difficulty that Hakim Sheikh had to face could have cost his life. We read about the story of Hakim Sheikh, in which nearly 14 hours he spent before getting treatment. Now 14 hours, it is too late, so there is a chance even he would have lost his life. So if hospitals cannot provide timely medical treatment to a person, it means that his protection of life is not being taken care. So right to life is very, very important aspect, as well as it is the duty of the it is the duty of the government to safeguard right to life. According to whom? According to the Constitution of India. The court also said that it was the duty of the government to provide necessary health service, including treatments in emergency situations. Hospitals and medical staff must fulfill their duty providing necessary treatment. Hakim Sheikh was denied treatment at various government hospitals before the court asked the state government to give him the money that had spent for the treatment. So that is the decision of the court in the story of Hakim Sheikh. So we completed the topic of public health service. So public health service, please understand, public health service means a service maintained by the government, and in the rural areas or in the village areas they are called as primary health center. Why it is called public? Because they are purely maintained by the government. From where the government gets money? Government gets money from the tax paid by the people. So who are the people who administer or taking care of primary health center? They are nurses, trained nurses and doctors. So in the district level we can see district hospitals. Okay. So then what is the duty of the government according to the Constitution? Because Constitution ensures right to life. So it is a duty of a government to ensure or safeguard right to life of a person. Okay. Let us move to the next major topic, that is private health facilities. Take for example, in Bijapur we have Alamin Medical College, BLD Medical College. So Alamin Medical College and BLD Medical College belongs to which category? Yes, they belongs to private health or private hospitals. Right in front of second gate, that is district hospital, belongs to public health or government hospital. Okay. There are wide range of private health facilities that exist in our country. Large number of doctors run their own private clinics. In rural areas, one find registered medical practitioners. Please write up RMP. RMP is registered medical practitioner. Now what is registered medical practitioner? They are not doctors, but they got a knowledge of medicine because of their ancestral knowledge or traditional knowledge. They don't have MBBS degree, but they can also administer drug or medicine. So definitely in your village areas you can see a lot of RMP doctors. They are registered medical practitioners. Urban areas, large number of doctors, many of them providing specialized services. There are hospitals and nursing homes that are privately owned. There are many laboratories that do tests and other special facilities like X-ray, ultrasound, etc. there are also shops from where we buy medicines. A chain of private health facility. What is a chain of private health facility? One, try to understand a chain of private health facility. One is medical shop chain. Second, X-ray center. Third, ultrasound. And definitely we speak about nursing homes and the private hospital. So registered medical practitioner, a person who don't have a MBBS degree but practices medicine in the rural areas, and large number of private hospitals. They are all come under the category of private health facility. Please write down the points. Please make notes. As the name suggests, the private health facilities are not owned or controlled by the government. Unlike public health service, in a private facilities, patients have to pay a lot of money for every service they use. Ranjan's story we seen that we read, he paid 3,500 rupees. So, since it is owned by private person, or it is not controlled by the government. So since it is not controlled by the government, patient have to pay a lot of money for every service they use. So in a private hospital, patient has to pay a lot of money for each and every service. Today, the presence of private facilities can be seen all around. In fact, now there are a large number of companies that run hospitals. Some are engaged in manufacturing and selling medicine. Medical shops are found everywhere in the corner of the country. Ranbaxy, Apollo, there are many chain of medical or shops, drug shops across the country. So please mention some of them. So this is a part of private health line. So what is a private? Why it's called a private healthcare facility? Because it is completely maintained, owned and controlled by the private people, not by the government. Since it is not controlled by the government, that's why we have to pay money for each and every service which is provided by them. Hope things are clear. Now let us move to the next topic, that is healthcare and equality. Question comes here now, is adequate health care available to all? Every now and then we watch news related to few untimely deaths due to lack of timely treatment available to the people. Maybe young kids, or maybe due to the trauma care centers or accidents and all. So the big question arises in our mind that is in India, do we have adequate health care? Means, are we equipped to provide health care to all the citizens of this country whenever it is required? So let us check the topic. In India, we face situation where private services are increasing but public services are not. What is then available to people are mainly private services. These are concentrated in urban areas and these services run for the profit. Try to understand the main issue here. So the major motive of private hospital, they run for profit. They don't run for charity or treatment, they mainly run for profit. When you run for profit, it is just a business organization. So medicines are expensive and many people cannot afford of this, and so as a result what happen, if someone is admitted in a hospital, I mean private hospital, the family has to borrow money, or sometimes even the family has to sell the entire property to save the life of their family members. So, in India, please try to understand, public service is not increasing as required. Means number of government hospitals is not increasing, whereas number of private hospitals are increasing. So what is increasing in India? That is private service, not the government service. So private service run for what? Run for profit. Since they run for profit, naturally the medicines and all other services are very, very expensive. Please try to understand. So what we have to increase, or what the government has to concentrate? Government has to concentrate to increase public service or the government hospitals more in number, not the private hospitals. In order to earn money, these private services encourage patients that are incorrect. At times, cheaper methods, though available, are not used. For example, it's common to find doctors prescribe unnecessary medicines, injection, saline bottles, when tablets or simple, where a simple medicine can solve. In the case of Aman and Ranjan, we seen that private hospital gave him a lot of medicine, syrups and all, and whereas the government hospital just gave 1 or 2 tablets and the problem is solved. So private hospital ask us to go for various tests so that they mint money or they make profit. In fact, barely 20% of population can afford of medicine required during the illness. Hence, even for those whom one might not think as being poor, medical expense cause very hardship. It is reported in a study that 40% of people who are admitted in a hospital for some or illness or injury have borrow money or sell some of their possessions to pay for the expense. Very sad figure. It clearly says that only 20% of Indian population is able to get the treatment, and 40% of people who admitted in a hospital, they definitely forced to borrow money or sell their property to get the treatment done. So this is the problem, where a person who are from middle class or a lower middle class or even from upper middle class, if his or her family members admitted in a hospital, they are forced to borrow money or take money from others, or even in extreme cases they sell their entire belongings because to save the life of a family member. So this is the problem. That means our entire earning or savings may vanish within few days or months if a person is not well and admitted in a private hospital. See the few pathetic condition of India, where a pregnant lady has to walk miles together to reach primary healthcare facilities. This is a very common scene in India, where in rural areas where there is no doctors, there is no road, ambulance facility is not there. Even though ambulance and doctors are there, the poor people, they are not able to pay for that. As a result, they were forced to depend on bicycles or even walk. Now you see, it's a Mahindra Jeep. Even Jeeps were used as a mobile clinics. Means primary health center doctor reach to the village and administer medicine. This is the pathetic or very, very poor condition in India, where healthcare facility is not grown up to expected mark. For those who are poor, every illness in the family causes a great anxiety and distress. What is worse is that the situation tends to happen again and again. Those who are poor are the first place undernourished. These facilities are not eating. These families are not eating as much as they should. they are not providing basic necessities like drinking water, adequate housing, clean surroundings, etc. Therefore, more people likely fall ill. The expense on illness make their situation even worse. So what is very important, please try to understand. We should have adequate or a very healthy drinking water, a good housing, clean surroundings. If we are able to take care of this minimum 3 needs, definitely we can say goodbye to several illness. Sometimes it is not only the lack of money that prevent people from getting proper medical treatment. Women, for example, are not taken to a doctor in a prompt manner. Women's health concerns are considered to be less important than the health of men in the family. Many tribal areas, few health centers, and they do not run properly. Even the private health services are not available. This is a very pathetic condition of India. Now we gone through all these things. Now the question is that what can be done? Okay, what can be done? We will study in the next class. Take care. Please write down important points which are displayed in the PowerPoint presentation. Take care. Wish you a wonderful day.